क्या डॉक्टर मीनन जी? जी। ओके। बट I'm out somewhere. I'll be back by before 10. तो संभालिए। अगर सपोज वो कहते घूम का ये डेथ सर्टिफिकेट हम लोग कल परसों में भी भरवा सकते हैं ना? डेथ। खुल गया। खुल गया। आज क्या तारीख है? 19। आ गया। ये रहा यूट्यूब सीरीज। ओके ओके। ओह, ये तो कनेक्टेड ही नहीं था। लाइव कैसे कर दिया आपने? ये कोई नहीं। डॉक्टर साहब, आई होप आई एम ऑडिबल। डॉक्टर जे कैंड्रयूज, आई होप आई एम ऑडिबल। एक कितों यूट्यूब दी चैट, लाइव चैट। डॉक्टर एंड्रयू, आई होप आई एम ऑडिबल। डॉक्टर राहुल जी, अभिषेक जी, विक्रम जी। अब कुछ हुआ? यहाँ पे तो आया, बट लाइव चैट में मेरी स्टूडेंट लोगों से बात नहीं हो पा रही है। नहीं, डॉक्टर साहब लोगों को दिखाई दे रहा है। वो जवाब नहीं दे रहे फिर। भाई उस टीवी पे ही दिखा दो, किसी पे दिखा दो। ये तो कुछ और चल गया। तो कुछ और चल गया। ओ चल गया, अब आ गया, अब आ गया, अब आ गया। जी 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 जी। बहुत ठीक है। भाई एसी का रिमोट नहीं है? नहीं चल रहा? पखा पुखा चला दो। ये कर दिया मैंने डुप्लीकेट। हाँ। पीडीएफ भेजेंगे डॉक्टर साई मोहन जी। अच्छा, ये ठीक है। क्या है, जवानी बढ़ी है ना तो गर्मी। डॉक्टर पापड़ी मंडल जी, पूरा नाम आपका? अवधेश जी, यार तेरा काम सेट नहीं है भाई। हाँ, स्क्रीन तो ब्लैक आ रही है यार। दीपाली बेटा, मेरे को जो आज बताया ना डॉक्टर पारस का, कल परसों में मैसेज आया था, तो क्वेश्चन के लिए कंसाइज क्लास मोस्ट लाइकली वो कराएंगे। कंसाइज क्लास मोस्ट लाइकली गुलियानी सर कराएंगे इस बार। हेलो जी। हाँ, पार्टी टाइम तो है, लेकिन बीच में मेरे को देखो, टू बी ऑनेस्ट, आई रियली 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 लाइक बीइंग विद यू। तो मुझे जैसे ही अपॉर्चुनिटी मिली, मैंने एक मिनट नहीं सोचा। रात को शायद 1:30 पौने 2 बजे डॉक्टर पारस का मैसेज था, तो उस मैंने उसी समय हेलो हाँ बोल दिया तुरंत से कि हाँ जी, मुझे तो अपॉर्चुनिटी चाहिए आप लोगों के साथ रहने के लिए। थैंक यू बड़ी। चाय मंगा दो तो अच्छा है ना। और वाटर बॉटल जी एक। फाइन है। ना ना ना, कुछ नहीं। अच्छा, ऐसा है, आपके पास आने से पहले मैं थोड़ा सा लेट हो गया, राइट? डोंट वरी, आई विल स्पीक मिक्स, हिंदी एंड इंग्लिश बोथ। अरे डॉक्टर पारस भी हैं। थैंक यू डॉक्टर पारस, आई एम सो ग्लैड। जी। सो आपके पास आने में मैं लेट हो गया, क्यों? मैं पूरी डिटेल नहीं डाइवल्ज कर सकता फॉर द प्राइवेसी रीजन, बट देन यू सी देयर वाज अ 28-year-old मेल। फाइन। क्या हुआ? द पेशेंट हैड फॉल फ्रॉम स्टेयर केस। कब की बात है? आज 2:10 के आसपास। फाइन। फॉल फ्रॉम स्टेयर केस क्यों हुआ? बिकॉज ऑफ कन्वल्शंस। मरीज पहले ही सीजर डिसऑर्डर में था। He was taking anti-epileptics. Now, because of seizure, he fell down from the stair. Fine. Now, patient was apparently doing all right. At around 5 o'clock, patient felt dizzy. Fine. And patient collapsed. Fortunately, patient, it was just around 10 minutes away from the hospital. So, वो लोग फटाफट से उसको हॉस्पिटल लेके आ गए हमारे पास, राइट? टेल मी व्हाट हैपेंड टू द पेशेंट। टेल मी व्हाट हैपेंड टू द पेशेंट। हेलो जी डॉक्टर साहब। ना अजय जी ना। बताइए क्या हुआ पेशेंट को। मैं फिर से रिपीट करता हूं। 28-year-old मेल, known patient of epilepsy. He had fall from staircase at around 2 p.m. today. Known case, on anti-epileptic drugs. At around 5 p.m., while he was still at home, he felt dizzy and collapsed. He was brought here. हमारे यहां लेके आया गया उसको, पेशेंट को। वेरी गुड, वेरी गुड, वेरी गुड, वेरी गुड। अच्छा, आप सबने सही आंसर दिया। दैट प्रोबेबली द पेशेंट हैड एक्स्ट्रा ड्यूरल हीमाटोमा, राइट? Probably the patient had extradural hematoma at around 2 o'clock. Now, 2 बजे से लेके 5 बजे तक, फ्रॉम 2 p.m. to 5 p.m., patient had lucid interval. Patient had lucid interval, right? So patient collapsed at 5 p.m. So most of you will say it is extradural hematoma, right ji? Extradural hematoma. Now, I am going to write something probably which will change your diagnosis. Probably which will change your diagnosis. Right? Now, blood pressure of the patient when the patient presented to us was 80/60. Was 80/60. Pulse rate was 122 per minute. Now tell me what happened. Now tell me what happened. When the patient was brought to our hospital at 5 p.m., the blood pressure was 80 by 60, naturally millimeter of mercury, and the pulse rate was 122 per minute. Exactly. Exactly. So that means patient did not have a head injury. Patient did not have a head injury. Patient had an abdominal injury. Patient had, probably had an abdominal injury. डॉक्टर साहब, डॉक्टर देखो ये स्क्रीन बड़ी छोटी है, तो अगर मैं आपका नाम गलत प्रोनाउंस करूं प्लीज डोंट माइंड. डॉक्टर सरधरा जी, ल्यूसिड इंटरवल में पेशेंट विल जस्ट कंप्लेन ऑफ हेडेक, नथिंग एल्स. पेशेंट विल जस्ट कंप्लेन ऑफ हेडेक, नथिंग एल्स. राइट. सो मैं इसी पेशेंट को अटेंड करते समय थोड़ा सा लेट हो गया आपके पास आने के लिए, 7 बजे डॉट पहुंचना था, बट ये पेशेंट यंग मेल, इसको थोड़ा सा टाइम, अटेंशन, सब कुछ चाहिए था. Fine. So patient probably had abdominal injury. Probably had abdominal injury. Remember, in the head injury patient, blood pressure would be high and heart rate would be low. In hypovolemic shock, blood pressure naturally would be low and heart rate naturally would be high. Heart rate naturally would be high. Right? Naturally would be high. Okay. Now, अब आप लोग तो बिल्कुल all set थे एग्जाम के लिए. Fine. Now, please tell me type of shock where you see decreased heart rate. Type of shock where do you see decreased heart rate? Type of shock where you see decreased heart rate. Dr. Logan, no. It is not that always you will see vomiting, but yes, due to irritation of the meninges, you might see vomiting. Na ji. Na. Type of shock where do you see decreased heart rate, that means bradycardia. Now, Anuj ji, Rajlakshmi ji, galat answer. Yes, cardiogenic shock, late stages when the patient is absolutely failing. Fine. So, you will see that in neurogenic shock. Neurogenic shock. Yes, exactly, neurogenic shock. Acha. Type of shock where you will see increased blood pressure. Ulta. Where you will see increased blood pressure. Type of shock where you will see increased blood pressure. Exactly. Septic shock. Warm stage. Septic shock, warm stage. Okay. Now, listen to me carefully. Your patient has normal blood pressure. Fine. Your patient has normal heart rate. Normal heart rate. Fine. Cardiac output is also normal. Even then I say your patient is in shock. Is that possible? Is that possible? No, Dr. Urvisha ji, no. Yes. So it is possible in stage 1 of the shock. Fine. Now, again, the next thing, it is also possible in dissociative shock. Also possible in dissociative shock. Dissociative shock. Remember, dissociative shock will be seen in cyanide poisoning. It will be seen in carbon monoxide poisoning. Right? कार्बन मोनोऑक्साइड पॉइजनिंग। हाँ जी। So I have new questions, but then, here and there, you might see some one or two old questions also. The online batch, probably we have read one or two questions there. Yes. Have we read this question? In the earlier discussion, have we read this question? Online, offline, have we read this question before? Okay. So 76-year-old female presented to surgery emergency with complaint of severe pain in the groin region. On local examination, tender swelling. The word tender swelling itself indicates strangulated hernia. Right femoral region below and lateral to the pubic tubercle. Below and lateral to the pubic tubercle. Now she has had multiple bowel movements. Multiple bowel movement means patient has no obstipation. भाई मरीज गैस पास कर रहा, मरीज स्टूल्स पास कर रहा। देखो कायदे से तो यही होता है हर्निया। पहले हर्निया होता है जी रिड्यूसिबल। Those of you who cannot understand Hindi, don't worry, I'll be speaking in English also. I'll be translating everything to English. Now, first the hernia is reducible, then the hernia becomes irreducible, then the hernia becomes obstructed, then the hernia becomes strangulated, then the hernia becomes strangulated. But here, you see there is no obstipation, that means there is no obstruction. That means there is no obstruction. There is no obstruction. That means only one type of hernia can present, Richter hernia. Sorry. So Richter hernia is when there is partial circumference of intestine. Partial circumference of intestine gets strangulated. Partial circumference of intestine will get strangulated. Fine. Okay. Now, lymphadenitis can also present. Lymphadenitis can also present as tender swelling. Can also present as tender swelling. Fine. But the problem is there are no other symptoms. There have been no other symptoms. Diverticulitis is generally left-sided. Remember, most common side of diverticulum is the sigmoid. So pain would be left-sided. Pain would be left-sided. Yes, so that's why ना डॉक्टर साहब अपने कौन है डॉक्टर साहब अपने डॉक्टर आदर्श जी। तो देखो मरीज को और कोई सिम्टम नहीं है तो इसलिए हम उसको सेफली एक्सक्लूड कर सकते हैं। नाउ valvulus. Remember, in case of valvulus, there would have been strong obstipation, distension of the abdomen. वो सब तो नहीं है इसमें, right? Age is actually supporting. Age is actually supporting. Fine. Okay. So this is the question. I thought that probably we have discussed this question before. मुझे लगा कि शायद हमने पहले ये क्वेश्चन डिस्कस किया है ऑनलाइन में या ऑफलाइन में, या उस समय ध्यान नहीं गया होगा जी आपका। सो दिस इज रिक्टर हर्निया। बीच में किसी डॉक्टर साहब ने बोला हमारे कि अपेंडिक्स है हर्निया में। सो रिमेंबर, इफ द हर्निया हैज अपेंडिक्स, it is called as amai and hernia. It is called as amai and hernia. It is called as amai and hernia, right? Remember, if let's say we say that your patient has pantaloon hernia, pantaloon hernia. So pantaloon hernia is both direct inguinal hernia and indirect inguinal hernia. Indirect inguinal hernia. Fine. Remember, you don't have to make this mistake that most common groin hernia in females is indirect inguinal hernia. Most common groin hernia in females is indirect inguinal hernia. Direct inguinal hernia practically is not known in females, is practically not known in females, right? Remember another thing, that femoral hernia is more common in females. कैसी females? Multiparous females, multiparous females, right? Femoral hernia is prone to strangulation. Femoral hernia, remember, it is prone to strangulation, prone to strangulation. Hanji Roksab, I'm sorry. See, this question is like, sometimes your examiner may be interested in asking you offbeat questions. Thank you जी. वो जो होता ना एकदम से एग्जामिनर सांप निकाल देता, वैसे वाला. Yes. करीजा फोन नहीं उठाऊंगा. किसी एमएलए साहब के पीए हैं. हाँ जी. Which is marked as RL3. So let's see. See, what is this? Is European Hernia Society classification. P is for primary hernia. No surgery has been done. No surgery has been done. R is for recurrent hernia. Recurrent hernia. Surgery has been done, but after surgery there has been recurrence, and recurrence is common after herniorrhaphy. Recurrence is common after herniorrhaphy. डॉक्टर अजय, मैं मानता हूं इट इज नॉट रिक्वायर्ड, बट द प्रॉब्लम इज कि एग्जामिनर कुछ भी सांप निकाल देता किसी भी समय. फाइन. तो उसके लिए मुझे लगता है कि एक आधा एक रैंडम हम लोग पढ़ लेते हैं. राइट नाउ, इफ इट इज लेटरल, remember, lateral to inferior epigastric artery. So what kind of hernia it would be? Indirect inguinal hernia. Indirect inguinal hernia. Fine. Remember, if it is written M, M is medial to inferior epigastric artery. So what kind of hernia it would be? It would be direct inguinal hernia. Direct inguinal hernia. तभी तो कह रहा हूं, कुछ पता नहीं एकदम से पूछ लेते हैं वो लोग. F is for femoral hernia. Femoral hernia. Fine. Now 1, 2, 3. So 1, 2, 3 is if you can insert just one finger in the hernia. Just one finger in the hernia. 2, like if you are able to insert 2 finger breadth inside the hernia, और अगर बिल्कुल ही खुला सा है, fine, in that case it would be 3. Like the defect is more than 3 centimeter. Defect is more than 3 centimeter. तो देखते हैं हमारे पेशेंट में क्या था. See, R. So that means it is a recurrent hernia. That means it is a recurrent hernia. Fine. Now L. L means lateral. That means it is indirect inguinal hernia, indirect inguinal hernia. And 3, that means the defect is more than 3 centimeter, more than 3 centimeter. Fine. So that means more than 2 finger breadth, more than 2 finger breadth. So first of all, it is not right. It is R stands for recurrent. R stands for recurrent. And it is an indirect inguinal hernia which is more than 3 centimeter in size. I'm sorry, Doctor Sahab, Dr. Clark Sahab, एक बार फिर से क्वेश्चन लिखेंगे जरा, क्या बोला आपने? I'm really sorry, I missed on your question, please. आप बस ये लिखें कि मेरा क्वेश्चन देखो. डॉक्टर क्लर्क साहब ने लिखा इनडायरेक्ट एंड फिमोरल हर्निया इज कॉमन. डॉक्टर साहब, 2 different question. Which is the most common groin hernia in female? Answer is indirect inguinal hernia. Femoral hernia is not that common. Males में भी common नहीं है, female में भी common नहीं है. If they ask you femoral hernia is common in males or females, in that case your answer will be that sir, femoral hernia is common in females. Femoral hernia you get to see very, very rarely. Last year, we bumped across a patient of femoral hernia. मेरे सारे असर लाइन लगा के लग गए, सर ये केस मैं करूंगा, ये केस मैं करूंगा. क्योंकि we rarely get to see this. हाँ जी, please see the question. 30-year-old women direct hernia itself is very, very rare. Direct hernia is common in elderly male. Is common in elderly male. You'll not get to see direct hernia in females. The reasons are not clear, but it is extremely uncommon in females. नमस्कार जी, गोविंद जी. हाँ जी, इस क्वेश्चन का आंसर दीजिए. For the first time, it's some woman who has fallen from the roof. Generally, males को गिराते हैं questions में. From the roof of her house. On arrival in the emergency department, she is noted to be opening her eyes to speech. Opening her eyes to speech. Remember, there are 4 eye signs. So, if your patient is opening spontaneously, if your patient is opening the eyes spontaneously, the score will be 4. If your patient is opening the eyes to the speech, fine, so the score would be 3. If your patient is opening eyes to the pressure, the score would be 2. And if there is no response, the score would be 1. So that means eye signs, the score is 3. Okay. She moves in response to painful stimuli by withdrawing her arms. By withdrawing her arms. So that means, remember what was there in the motor score. In the motor score, if your patient obeys 2-part command, 6. Fine. If your patient can localize the pain, 5. Fine. If, now, what comes next? What comes next is your flexion, normal flexion. Then abnormal flexion, then extension, abnormal extension, and if there is no response, the score would be 1. So you see here the motor signs are 4, right? Now, using inappropriate words, right? So let's say if your patient can communicate coherently, fine. Your patient is oriented to time, place and person, 5. Confused, 4. Fine. Now comes, your patient can utter some words, fine, your patient can just make some sounds, and if there is no response at all, the score would be 1. Yes, exactly. Fine. So the score would be 3. So eye signs are 3, motor signs are 4, and the verbal signs are 3. So the total score comes out to be 3 plus 3 plus 4. Fine. 10. 10 comes out to be the total score. आदर्श जी, आप क्यों गलत गिन लिए? डॉक्टर आदर्श जी, आपने क्यों गलत गिन लिया? डॉक्टर जीत साहब, आपने क्यों गलत गिन लिया? ना बेटा, जीसीएस में तो कोई गलती मत करो. देखो, विद ऑल ड्यू रिस्पेक्ट, आई टोटली अंडरस्टैंड कि आपको लगता है कि यार टाइम वेस्ट होता है बार बार वही चीजें पढ़ते जाने पे, बट मुझे लगता है कि जहां पे भी आप गलती करते हैं एटलीस्ट वो वाली चीजें हम लोग एक बार दोबारा पढ़ ले तो थोड़ा सा बेटर रहेगा. फाइन. वेरी क्विकली हम लोग जीसीएस के फटाफट से क्वेश्चन करते जाएंगे, आप जवाब देते जाएंगे. फाइन. What factors can interfere with GCS assessment? These questions are taken directly from the website. Now only 1 or 2 questions are repeated, rest all are new questions. जो हम लोग ऑलरेडी डिस्कस किए, उसके अलावा नए क्वेश्चंस हैं. चौधरी साहब, ये छोटी सी मिस्टेक भी भारी पड़ जाती है, तो छोटी मोटी गलतियां मत करो. समय एक्स्ट्रा मिला है तो उसको हम यूटिलाइज करेंगे और सीधा एक ही बार में पीजी फोड़ के निकलेंगे. So language or cultural differences. Let's say patient cannot understand your mother tongue and you cannot understand mother tongue of the patient, right? Intellectual or neurological deficit. Patient is having aphasia. So you will not be able to assess the verbal score. Fine. Hearing loss. आप कुछ भी पूछते रहो, मरीज को सुनाई कुछ नहीं दे रहा. Right? So all of the above is the answer. See. This pre-existing factor. If you have done intubation or tracheostomy, patient will not be able to speak. So what will you write? VNT, vocal not testable. You have given sedation. Patient is having hemiplegia, paraplegia, quadriplegia. You cannot assess the motor score. Maybe his brain is perfect, but let's say there is injury to the spine. Lag gayi. Effect of other injuries: orbital injury, cranial fracture. Remember, here you will write ENT, eye not testable. Dysphasia or hemiplegia, spinal cord damage. Right? These are the factors. हाँ जी, ये फिर से वही repeat question. GCS is not useful in. डॉक्टर पापी साहब का लास्ट जवाब था, इसके बाद आगे का जवाब देना शुरू करेंगे. डॉक्टर साहब, ब्रेन एब्सेस विल कॉज, आप ध्यान दीजिए, ब्रेन एब्सेस विल कॉज सेरिब्रल एडीमा. जीसीएस ऑफ द पेशेंट विल बिकम सुपर लो. ओके. Poisoning can interfere with CNS function. Remember, what is the purpose of GCS? Purpose of GCS is quick neurological assessment. Right? So answer is none of the above. So remember, GCS apart from head injury is useful in ischemic stroke, it is useful in poisoning, it is useful here, it is useful in general trauma as well as non-accidental trauma and spontaneous subarachnoid hemorrhage. Answers भी वहीं से लिए गए. ये फिर से वही क्वेश्चन रिपीट. मैं मानता हूं ये क्वेश्चन मैंने आपके साथ डिस्कस किया था क्लास में, बट मुझे लगा इंपॉर्टेंट है तो दोबारा डिस्कस कर लेते हैं जी. आप देखो, दोबारा जो हम लोग डिस्कस कर रहे हैं क्वेश्चन, घड़ी के हिसाब से 5 या 7 मिनट लगेंगे. राइट? पर इसमें गलत आंसर मत दीजिए. 28-year-old male was brought to surgical emergency after he was rescued from a mangled car. His GCS score is E3V4. कितना हुआ? 12. GCS score is 12. That means less than 15. अच्छा, ये चलो आपको याद है। अब देखते हैं आगे वाली बात आपके मरीज को याद है कि नहीं। लिसन टू मी, सॉरी, आपको याद है कि नहीं। पेशेंट वॉज ब्रॉट एट 8 p.m. At 8 p.m. his GCS was 12. अच्छा, आपने क्या किया? You kept on measuring it for 30 minutes. Every 30 minutes you kept on checking. आप हर आधे घंटे में एकदम बढ़िया डॉक्टर की तरह, डेडिकेटेड डॉक्टर की तरह उसका जीसीएस चेक करते रहे। बड़ी अच्छी बात है जी। अब अगले दिन सुबह 10 बजे आपके मरीज का जीसीएस आ गया 15, एकदम नॉर्मल, फाइन। अब बताइए कब चेक करेंगे? 10 बजे आपके मरीज का जीसीएस आ गया नॉर्मल, अगली बार आप दोबारा कब चेक करेंगे? 10:30 बजे, 11 बजे, 11:30 बजे या 12 बजे? यही तो फंसती है चाबी, यही तो फंसती है चाबी। नाउ, जब तक जीसीएस 15 नहीं हो जाता तब तक तो हम लोग हाफ आवरली चेक करेंगे, लेकिन जैसे ही जीसीएस 15 हुआ, अगले 2 घंटे तक, फॉर नेक्स्ट 2 आवर, विल कीप ऑन मेजरिंग फॉर एवरी 30 मिनट्स, एवरी 30 मिनट्स। फिर नेक्स्ट 4 आवर्स में विल कीप ऑन चेकिंग every 1 hour, then 2 hourly thereafter, 2 hourly thereafter, fine, 2 hourly thereafter। तो 30 मिनट्स आपने याद रखना है मिनिमम, कम से कम आपको इतना तो जी याद रखना ही रखना है कि हर आधे घंटे में आपने जीसीएस चेक करना ही करना है, राइट। ये बाकी वाली कहानी नहीं भी याद रखोगे चलेगा। हाँ जी, एलिमेंट्री सिंपल बेसिक क्वेश्चन। दिग्विजय जी इसका आंसर दीजिए जरा। कुणाल जी, नवनीत जी, प्रहलाद जी, अवधेश जी, प्रियंका जी, डॉक्टर आयशा। नवनीत बेटा यहां क्यों गलत आंसर दे दिया? इट इज चेक। व्हाट डू यू चेक? the surrounding. You check for the interfering factors, interfering factors. Then you observe the patient without stimulation. Then you stimulate the patient. Stimulation can be by sound, can be by touch. Remember, no pain. Then you will do the final rating of the patient. So the correct order is check, observe, stimulate and rate. Check, observe, stimulate and rate. Check, observe, stimulate and rate. ये बड़ा इंपॉर्टेंट है जी। मतलब आई डोंट नो कि आप क्यों इसको मिस कर गए आंसर करना, स्पेशली जब हमने 2-3 बार इसको डिस्कस कर लिया इस क्वेश्चन को। चेक, ऑब्जर्व, स्टिमुलेट एंड रेट। रिमेंबर, क्योंकि अपने हमने वो पीपीटी नहीं खोली, आज मैंने सोचा था कि आपका टाइम नहीं वेस्ट करना। 2 घंटे है तो एकदम क्रिस्प 2 आवर्स ही रखेंगे, उसके बियॉन्ड खींचना ही नहीं है, उसके पहले पहले फिनिश करेंगे, राइट। बिकॉज आई अंडरस्टैंड कि थोड़ी देर में आप लोग बोर होने लगते हैं। सो यू सी, रिमेंबर 3 काइंड ऑफ स्टिमुलस आर अलाउड, फाइन। कौन सा? फिंगर टिप प्रेशर, फिंगर टिप प्रेशर। उसके बाद कौन सा? ट्रेपीजियस पिंच, ट्रेपीजियस पिंच। इसके बाद फाइनली एट द लास्ट सुप्रा ऑर्बिटल प्रेशर। सो इट हैज टू नेसेसरली गो इन दिस ऑर्डर, फाइन। ये ऑर्डर आप चेंज नहीं कर सकते। द पर्पस ऑफ चेक, I just answered this question to identify the factors that may interfere with the assessment. For example, there might be loud sound, there might be poor light in the room, there might be language barriers, fine. So all of this you have to see. अरे डॉक्टर क्लर्क साहब, आपके कितने सारे नाम हैं कि 3-4 लोगों के नाम जोड़ लिए बीच में। अब ये वाला क्वेश्चन भी हमने पढ़ा था, बस फटाफट से इस क्वेश्चन को करते हैं, 30 सेकेंड्स आंसर देके आगे चलते हैं। मोहित जी, एमएलए साहब का फोन आया था, जरा इस पेशेंट का देख के मुझे मैसेज छोड़िए, और जो हो सके वो करा दीजिए। हाँ जी डॉक्टर साहब। सो कंफ्यूज, if your patient is not able to answer your query, if your patient is not able to give you intelligent answer for whatever the reason may be, whatever may be the reason, we will write it as confused. If your patient is giving wrong answer, we'll write it as confused. एक और क्या होता है, your patient is in hospital and patient says, doctor, I am in ambulance. आसपास तो वही डॉक्टर लोग दिखाई देते हैं, पैरामेडिक्स दिखाई देते हैं, बट कोई भी आदमी इतना कंफ्यूज नहीं होता कि कमरे में और एम्बुलेंस में फर्क ना जान सके। फाइन। सो ये जनरली ये क्वेरी आती है, हॉस्पिटल वर्सेस एम्बुलेंस। हाँ जी, अगेन द सेम क्वेश्चन, ये हमने डिस्कस किया हुआ पहले, याद आया कुछ जिन लोगों ने ऑनलाइन बैच में अटेंड किया था या ऑफलाइन बैच में अटेंड किया था, वी हैड दिस क्वेश्चन. So only GCS questions are repeated, rest all questions are new. चौधरी साहब, डॉक्टर मर्सी, डॉक्टर अनुमित जी, डॉक्टर माहिर जी, बेटा जी क्या कर रहे हो यार, अभी मैंने बताया. Especially I told that you cannot change this order. Fingertip pressure, then you have to give trapezius pinch, then you have to give supraorbital pressure. You cannot record normal flexion. Fine, because your patient is bending his elbow when the fingernail bed is stimulated. Fine, this will be the next step. This will be the ideal option, trapezius pinch. First you will do the trapezius pinch, then you will apply supraorbital notch pressure. Fine. अरे एमएलए साहब तो हमारे वैसे खुद फंसे हुए हैं आजकल. हाँ जी, वेरी सिंपल क्वेश्चन, एक्सट्रीमली सिंपल क्वेश्चन. Exactly. So if your patient can raise his hand above the clavicle, किसी तरह भी मरीज अपना हाथ क्लैविकल के ऊपर ले गया, that means patient can localize the pain. Patient can localize the pain. हाँ जी, GCS PA charts. Remember, GCS P is GCS minus PRS. डॉक्टर साहब ध्यान से पढ़ो, इसमें गलत आंसर मत दो. स्पेशली ऑनलाइन बैच वाले इसका गलत आंसर अगर देंगे ना तो मैं वहां क्या करें बच्चे, आप अपने कुछ बोल भी नहीं सकते. आपको गलत आंसर मत दो, हमने डिस्कस किया हुआ आपके साथ ये. When did I say volume of intracranial hematomas? It is just based on number of intracranial hematomas. Number of intracranial hematoma. Remember, no CT abnormality. Prognosis is good. If there is one CT abnormality, prognosis is bad. If two or more than two CT abnormality, prognosis is worse. Prognosis is worse. So it is not based on the volume. It is just based on number of intracranial hematomas. Number of intracranial hematomas. Speaking about this patient, अब इस मरीज का जिक्र करें तो हो सकता है इस मरीज में सब अरेक्नोइड हीमाटोमा भी हो, प्लस सब ड्यूरल हीमाटोमा भी हो, प्लस एक्स्ट्रा ड्यूरल हीमाटोमा भी हो. Your patient can have all the three. May have subarachnoid, subdural, extradural, anything. Fine. Now, another case. Your patient has subdural hematoma plus subarachnoid hematoma. तो इस केस में कितनी abnormalities? 2. इस केस में कितनी abnormalities? 3. The prognosis is same. Bad. Sorry, worse. Right? So it is just based on the number of intracranial hematomas. डॉक्टर साहब गलती मत करो, स्पेशली एक बार जब पढ़ लिया तब तो बिल्कुल ही गलती मत करो. हाँ जी, आंसर दिस क्वेश्चन प्लीज. यू हैव टू टेल मी व्हाट इज द पेशेंट सफरिंग फ्रॉम. उसके बाद आगे की बात करते हैं. 80-year-old female presented to surgery emergency with complaint. 80-year-old. That means your patient happens to be an elderly lady. Now you got the hint. Abdominal pain, distension, vomiting for 2 days. She was noticed to have painful lump in her left groin. Patient also complains of left knee pain. Tense, palpable lump below the pubic bone. Below the pubic bone, not below and lateral to the pubic tubercle. डॉक्टर साहब आंसर तो दे दो, बट पहले बताइए है क्या पेशेंट को. व्हाट इज द पेशेंट सफरिंग फ्रॉम. अरे वाह, डॉक्टर नजीब ने टेक्निकल आंसर दे दिया. एंटेरोसील. एंटेरोसील जस्ट मींस प्रेजेंस ऑफ इंटेस्टाइन एज द कंटेंट ऑफ हर्निया. इसमें भी क्वेश्चन पूछेंगे अभी आगे चल के. कूल भाई शुभ जी. नो नो नो, प्लीज टेल मी व्हाट इज द पेशेंट सफरिंग फ्रॉम. Old lady hernia, French lady hernia. Your patient probably has obturator hernia, which can be palpated on rectal examination as well as per vaginal examination, right? Obturator hernia. Fine. That is why the pain is reaching up to the knee joint. That is why the pain is reaching up to the knee joint, right? कहा था आज फटाफट से उड़ाएंगे क्वेश्चंस. काहे का प्रोलैप्स यार, गानी मत लेके आओ यहां पे. सब्जेक्ट ही बड़ा पसंद है आपको. It can be felt anywhere. Per vaginal also you can feel, per rectal you can also feel. हाँ जी डॉक्टर साहब जी, इसका आंसर दीजिए. 41-year-old male, non-diabetic, non-hypertensive, that means healthy patient. Okay, with a rapidly enlarging wound over right leg. Diagnosis of necrotizing fasciitis was made and debridement was done. Samples were sent for microbial assessment. Culture from the wound are most likely to show growth of which organism? ना डॉक्टर अजय, देखो ऐसे क्वेश्चन नहीं आएंगे, ज्यादा करके क्वेश्चन इस तरह के होंगे लड्डू जैसे. इजी. INECET का पेपर देखा, एक पार्ट इजी था, एक पार्ट थोड़ा सा डिफिकल्ट था. तो कुल 4 या 5 क्वेश्चन थे जो थोड़े ट्रिकी थे. ग्रुप ए स्ट्रेप्टोकोकाई. ग्रुप ए स्ट्रेप्टोकोकाई. अब मुझे थोड़ा सा समय देंगे. See, so necrotizing fasciitis type 1, polymicrobial. Polymicrobial is most common. But remember, necrotizing fasciitis here will be seen in immunocompromised patient, unhealthy individuals, especially diabetes mellitus patient. डॉक्टर साहब क्या करें ना, चलो जो बीत गई बात गई, दैट इज पास्ट, उसको छोड़िए, fine. And then the patient who have undergone chemotherapy. But if your patient is healthy, fine, so it would be group A beta hemolytic streptococci, group A beta hemolytic streptococci, right? This one thing. See, type 1 diabetic immunocompromised peripheral vascular disease, fine, otherwise healthy. So if your patient is healthy, it would be caused by group A beta hemolytic streptococci, fine. Now 3 is by marine exposure, Vibrio vulnificus, fine. 4th is by fungal, right? Important G. Now if it is affecting the scrotum, remember what it is called. It is called as Fournier gangrene. What is the treatment? Aggressive debridement. Hanji. Easy question. Now this I would call is a one-liner. I would call this is a one-liner. Yes. Sutherland formula. It's a one-liner question. See, buddies. No. This is based on urine output. So minimum urine output would be 0.5 ml per kg per hour. After 24 hours, how much fluid is to be given, that will be decided by the urine output. Remember, Parkland formula is for initial 24 hours only. Calculate the volume of colloid. Here, remember you have different formula, Barclay and Muir formula, Ivan formula, Brooks formula. You just have to remember the name. Calculate the protein requirement, Davis formula. Now this is for Sutherland formula. What other formula? Curary formula. This is just a slightly difficult one-liner here. Calories and protein requirement of the patient. One-liner question there. देखो one-liner को भी ऐसे घुमा के जलेबी की तरह सामने रखते हैं, right? So they can do anything, examiners. हाँ जी. Post-operative complication. 54-year-old male underwent laparoscopic surgery for hiatus hernia. Right, G. Post-operative X-rays revealed that patient has developed pneumothorax. His post-operative recovery was uneventful. That means there are no clinical features. What do we expect in the patient of pneumothorax? We expect decrease air entry. We expect hyper resonance. We expect tracheal deviation. We expect mediastinal shift. नाउ जब तक ये क्लिनिकल फीचर है, केवल हम क्या बोलते हैं कि हमारे मरीज को है जी सिंपल न्यूमोथोरेक्स। जब हमारे मरीज को डेवलप हुआ शॉक, if our patient has shock, we will say patient has developed tension pneumothorax. Patient has developed tension pneumothorax. Tension pneumothorax. Now, since our patient has no clinical feature, we will do watchful observation only. We will do watchful observation only. Remember, watchful observation we will do if the pneumothorax has occurred. If the pneumothorax has occurred because of central venous catheter, central venous catheter, right? Please tell me which vein has more chances of pneumothorax. If you puncture that vein, which vein has more chances of pneumothorax? Subclavian or internal jugular? Subclavian, क्या बात, right? हाँ जी, 42-year-old, sorry डॉक्टर साहब, 42-year-old farm laborer present to surgery OPD. Long-standing ulcerated nodular lesion at the angle of mouth. Cervical examination was found to be unremarkable. Cervical examination was found to be unremarkable. What is the diagnosis first of all? नहीं डॉक्टर साहब, डॉक्टर नजीब जी, गलत. Internal jugular vein, less chances of infection. Most common chances of infection are with femoral vein. Na ji. Second is the wrong answer. First tell me what is the diagnosis. Okay. Diagnosis is already written, I'm sorry. Cervical examination was unremarkable. That means there is no lymph node enlargement. No lymph node enlargement is seen in basal cell carcinoma. No lymph node enlargement is seen in basal cell carcinoma. This is the answer. Moh micrographic excision. Moh micrographic excision. Remember, it is done for cosmetically important areas, like the outer canthus, of the eye, like the angle of mouth. So you will cut very little tissue. Now you have to remove the cancer also and you have to cut very little tissue also. अब दोनों चीजें हैं, आपने टिश्यू भी कम काटना है और आपने कैंसर भी पूरा निकालना है. वो कैसे होगा? मोह माइक्रोग्राफिक एक्सिजन से. मोह माइक्रोग्राफिक एक्सिजन से. डॉक्टर साहब, रेडियोथेरेपी प्रॉब्लम यह है कि फेस वगैरह पे रेडियोथेरेपी करना गलत हो जाएगा. एक मिनट डॉक्टर साहब, वो एमएलए साहब वाला आंसर दे दें. सर पेशेंट को देख रहे हैं जी, सीएमओ साहब हमारे वहीं पे हैं, वो देख रहे हैं पेशेंट को. जैसे कुछ स्टेटस चेंज होता है मैं अपडेट करता हूं जी. So radiotherapy will cause more scarring, हाँ जी, बताइए जी। ऐसे मत करो यार। अच्छा चलो, इसका आंसर बताइए। यूरोलॉजी। So your patient underwent TURP, prostate size 75 gram. Surgery lasted for, so that means prostate size is more than 75 grams. Surgery lasted for 90 minutes. Fine, more than 90 minutes. That means high chances of TURP syndrome. Remember, Doxa, what is TURP syndrome? TURP syndrome is water intoxication. TURP syndrome is water intoxication. Too much of the water is absorbed. Okay. Even on post-operative day 2, irrigation with 1.5% glycine has to be continued as his catheter showed some evidence of hematuria. मतलब अगले दिन भी bleeding हो रही थी. Patient became drowsy and developed oliguria. हो गया आपके मरीज को hyponatremia. Some pitting edema, water retention. In due course, patient developed seizure. Patient developed seizure means hypo. What is the problem here? That hyponatremia is causing organ failure. Low urine output. That means organ failure. किडनी फेल हो रहा मरीज का. अब बताइए क्या करते हैं मरीज को. देखो डॉक्टर साहब, चलो आपका मोरल बूस्ट अप करने के लिए जिन्होंने 3 आंसर दिया वो भी सही है, जिन्होंने 4 आंसर दिया वो भी सही है. फाइन. रिस्ट्रिक्शन ऑफ ऑल काइंड. सी, ड्रग ऑफ चॉइस इज फ्रूसेमाइड. That is the primary treatment. But if your patient is having any organ failure, in that case, hypertonic saline has to be added. Hypertonic saline has to be added. So this is the correct answer. This, would be the second best answer. This would be the second best answer because we have to give furosemide. We have to give furosemide. ये जो है हमारा 1.5% glycine. This is the fluid of choice. This is the fluid of choice for irrigation. लेकिन इसमें भी कई बार डेवलप हो जाता. हाँ जी. So this question probably should be there in the pathology class. अब चलो मैंने पूछ लिया तो मुझे आंसर दे दीजिए. आदर्श जी, हम दो तरफ फंस जाते हैं. हाइपरटोनिक सेलाइन कैन कॉज पोंटाइन डीमाइलिनेशन. या तो पोंटाइन डीमाइलिनेशन करा लो या किडनी फेल करा लो. हाँ जी, अब बताइए आंसर. 38-year-old फीमेल, neck mass, thyroid cancer. She was managed surgically. Histopathology of the neck swelling returned the following picture. डॉक्टर साहब ऐसे मत किया करो यार. This is a classical picture of bubble gum colloid. Bubble gum colloid. ये क्लासिकल पिक्चर जैसे इधर उधर खींचा हो, लाइक दिस. बबल गम कोलॉइड. बबल गम कोलॉइड. सो योर पेशेंट इज सफरिंग फ्रॉम पैपिलरी थायराइड कार्सिनोमा. अच्छा, अब आप में से कुछ लोग थोड़ा गुस्सा करेंगे कि सर ये सब चीजें थोड़ी ना आती हैं. चलो मैं मान लिया नहीं आती. बाकी के आंसर देखो कैसे गलत प्रूव करते हैं. फॉलिकुलर कार्सिनोमा ऑफ द थायराइड, एज 50 to 55. Medullary carcinoma of the thyroid, age around 60 years. Hurthal cell carcinoma, 50 to 55 years of age. Remember, papillary carcinoma of thyroid, 30 to 40 years is the age. 30 to 40 years is the age, right? And this papillary carcinoma of thyroid is considered to be the most common cancer of thyroid. तो अगर वैसे नहीं बनता आंसर तो दूसरी तरह बन जाएगा. अब कई बार क्वेश्चन में डॉक्टर साहब क्या होता है कि बड़ा एक टिपिकल सा लड्डू जैसा कीवर्ड उठा के आपके सामने रखा होता है. अब वो तो आपको ढूंढना आना चाहिए. इस क्वेश्चन में है लड्डू वो वाला, देखिए. मोस्ट ऑफ द टाइम एज इज एन एक्सट्रीमली इंपॉर्टेंट क्लू. अब इसमें मुझे सामने दिख रहा है कि एक बड़ा इंपॉर्टेंट सा क्लू है इस क्वेश्चन में. देखिए जरा, ब्रेंकियल सिस्ट. क्या क्लू है? व्हाट इज द क्लू डॉक्टर साहब लोग? anterior to the sternocleidomastoid muscle, that typically is branchial cyst. Typically is branchial cyst. Now, these two are commonly palpated in the posterior triangle of neck. Posterior triangle of neck. Fine. Now this, as you know, it is within the body of sternocleidomastoid muscle. हाँ जी. अरे राजेंद्र जी, ए मतलब लिखो, तो बोलते बोलते फिर कुछ और निकल आता साउंड. थैंक यू डॉक्टर साहब. 53-year-old diabetic hypertensive woman presents with complaint of long standing neck pain. लो जी डॉक्टर साहब, long standing neck pain, weight gain, malaise, tenderness along the course of thyroid gland without evidence of discrete mass. That means your patient has diffuse goiter. Long standing neck pain, that means your patient has some type of thyroiditis. Weight gain, that means your patient has hypothyroidism. So answer is Hashimoto thyroiditis. Acute suppurative thyroiditis will be common in children, and children who have pyriform sinus. Children who have pyriform sinus. Papillary thyroid carcinoma, there would be a nodule palpable, not diffuse goiter. Papillary thyroid carcinoma patient will be euthyroid. Riddle thyroiditis, there would be hard swelling. Right? डॉक्टर साहब, यूआरटीआई की हिस्ट्री रिडल में नहीं मिलेगी आपको. दैट यू विल सी इन सब एक्यूट थायरोइडाइटिस, also called as viral thyroiditis, also called as granulomatous thyroiditis. Riddle thyroiditis is a very, very slow process. Remember, what is the question which they asked? Riddle thyroiditis is only form of thyroiditis where you don't get to see hyperthyroidism, right? 52-year-old male patient presents with complaint of neck swelling and stridor. Neck swelling and stridor. बताइए जी क्या है? So this patient of yours is suffering from retrosternal goiter. See, this is the goiter which is present in thorax, and this is the goiter which is present in neck, and this happens to be trachea. क्या बात कर रहे हैं डॉक्टर साहब, दिल तोड़ दिया आपने। सुरजीत जी, दिग्विजय जी, जट लाइफ भाई, Pemberton sign will be positive. Remember, in retrosternal goiter, no radiotherapy, no radioactive iodine 131 is not to be used. 99% of the times, the surgery is the treatment option, and surgery should be done by cervical incision. Surgery should be done by cervical incision. Surgery by thoracotomy will be done if you have suspicion of cancer, if there is primary retrosternal goiter, if there has been previous neck surgery. This is not to be used. Fine. This is not to be used. So the correct answer is surgery using neck incision. ये तो डॉक्टर साहब बड़े बेसिक से क्वेश्चन है यार, अगर आप इसमें गलती कर रहे हो तो इसका मतलब आपका क्लास अटेंड करने का मन नहीं है ना, धक्के से बिठाया गया है आपको। Clue डॉक्टर साहब, see the image is typically showing retrosternal goiter. So in retrosternal goiter, remember, you never do radioactive iodine or any type of radiotherapy. You never do. Dr. Pradesh ji, in retrosternal goiter, the preferred treatment option is always surgery. You never perform radioactive iodine therapy or any kind of radiotherapy is specifically avoided because here the carotids can be damaged. अरे भाई अब तो 8 बज गए, जितनी मर्जी इंग्लिश बुलवा लो। 36-year-old multiparous woman, 20 weeks pregnant, presents to surgery OPD with complaint of persistent, tender left breast mass for 3 weeks. There is no past history of breast problem, no family history of breast or ovarian cancer. That means there is no strong family history. And she previously, that means there is no nulliparity. She has babies in the past. Physical examination discloses a firm but not hard, slightly tender, discrete 3 by 2 centimeter mass without any overlying skin changes. The patient came with recent bilateral mammogram which shows only dense breast without any obvious abnormality, read as BIRAD1. BIRAD1 means everything is normal. So what is the next thing? Ultrasound breast. MRI we will do in the high risk group. High risk group. Right? Oral antibiotics. Remember, they are to be given in case of, let's say your patient has lactational mastitis. But there is nothing like that. There is nothing like that. The pain is only because of increased vascularity. Only because of increased vascularity. So the preferred thing is ultrasound breast. Right? Hanji, the following device is useful for. डॉक्टर साहब एमआरआई नहीं कराएंगे, we won't get the MRI done because there is no risk factor. She has given birth to the babies. No nulliparity. Nulliparity is a strong risk factor for cancer. She has no family history suggestive of cancer. And basically MRI is normal. Right? So why get the mammography is normal. So why get the MRI done then? है क्या ये डॉक्टर साहब, वो बताइए पहले। Review after delivery, basically the swelling very well is there and mammography says normal. That means mammography could not catch the swelling. Why mammography could not catch the swelling? Because the density of swelling and breast is equal. So you will have to do some additional investigation. So you see, this is a Gibbon catheter. This is a Gibbon catheter for urinary drainage. Urinary drainage. So you must be able to identify the Nielsen catheter, must be able to identify the Nielsen catheter also. Must be able to identify the Levin tube. Levin tube, remember, is another type of nasogastric tube. How do you see the difference? Remember, there are markings. नो 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 डॉक्टर साहब, यूरिन के लिए तो 36 कैथेटर है कम से कम. फाइन. सालेम सम्प ट्यूब, this is the gastric tip, this is the nasal tip. Two things, Salem sum. Identify the following device. डॉक्टर साहब 9 बजे खत्म नहीं होगा क्योंकि हमने सवा सात शुरू किया था, तो 10 मिनट 9 से पार जाएंगे. ना यार ऐसे मत करो. सो इट इज अ Penrose drain. It is a Penrose drain. It is a Penrose drain. टिपिकल. ये तो बहुत कॉमन है जी, बहुत बहुत कॉमन है. क्यों मिस कर गए? वो वॉच मैं पहन के नहीं आया इसीलिए वॉच. डॉक्टर साहब ये क्या है? अच्छा चलो ये बताइए, व्हाट इज दिस? दिस इज जैक्सन Pratt drain. This is Jackson Pratt drain. This is corrugated drain. Corrugated drain. Fine. This, what you can see on your screen, this is Mellicott catheter. Mellicott catheter. Right, G? And this one, you can see here, it is the tip of intercostal tube. Yes, yes, yes. And what you see below, this is water seal. This is water seal. Right? Water seal. Hanji. Up again, this is a one-liner, and this is basically a stupid one-liner. I totally understand, but then your examiner is unpredictable, totally unpredictable. Hanji Doctor Sahab, answer. Water seal is used with intercostal tube. So remember, it is green goes everywhere. Green goes everywhere. So this was the mnemonic from some Instagram group. जिनका भी है एडवांस में उनको thank you. Right? So Foley's catheter color coding. Foley's catheter color coding. Green goes everywhere. So the most common size used is 14. Fine. Green goes everywhere. See, These are the different parts. These are the different parts of the Foley's catheter. So what is this? This is inflatable balloon. Inflatable balloon. Inflatable balloon. Right? So how do you inflate it? You inflate it with the help of distilled water. Normal saline is not used. Why? Because it will cause crusting. It will cause crusting. ये क्या हो रहा है बीच में? ये ध्यान हटता है यार पढ़ने से. See, the French gauze, right? So let's say if the size of the catheter is 14, then the diameter would be 4.7 millimeter. So 4.7 multiplied by 3 is 14 French, 14 French, right? So this formula should remember about the French gauze. So French gauze is diameter times 3. If the diameter of the catheter is 8 mm, the French gauze would be 24. French gauze or French size would be 24 French. Identify the surgical device. बहुत ही common. It is not a Foley's catheter. So it is a Caudet tip catheter. Caudet tip catheter. Caudet tip catheter. Right? I'll show you the next ones. See, what is this? This is Malicot catheter. Malicot catheter. Malicot catheter. This device can be used to administer. What is this device? So, the device which you can see is chemoport. Device which you can see is chemoport. Chemoport is placed subcutaneously, and with this we can give drugs, whole blood, fresh frozen plasma, basically anything. We can give anything through this. Anything we can give through the chemoport. Anything we can give through the chemoport. ये क्या हो गया? ये अपने आप ही चली जा रहा है. What is this? You have to identify the instrument. So because you have not seen this, this is Park anal retractor. Park anal retractor. Identify this instrument. Identify this instrument. Yes, identify this instrument. कोई एक जना आंसर करेगा तो मैं आगे चलूंगा. Deaver retractor. This is a Deaver retractor, also called as S-shape retractor. Also called as S-shape retractor. If you see a retractor like this, this would be Langenbach retractor. Langenbach retractor. I'll show you more pictures. See here. What you see here, Langenbach retractor. Langenbach retractor. This, as you can see, is Army Navy retractor. एक या दो डॉक्टर साहब. This is Wittliner retractor. Wittleiner retractor, Cocker retractor. And if you see it is curved like this would be Cali retractor. Cali retractor. Incidental finding, management. So this happens to be liver. This happens to be gallbladder. मैं इसको जूम करके दिखाता हूं, देखो जी. So what you see, while you were about to remove the gallbladder, you see that the liver is studded with blue colored nodules. Yes, Dr. Navneet Kaur, your patient is suffering from hemangioma and the management is watchful observation. Nothing needs to be done. Nothing needs to be done. Management would be enucleation. Enucleation if it is more than 7 centimeter in size. Investigation of choice would be contrast CT. Investigation of choice would be contrast CT. Hemangioma. Typical radiological finding. अरे डॉक्टर लोगान जी क्यों हंसे यार, हमें भी बता दो. Typical, very typical radiological finding. जब तक आप ढूंढते हैं, नहीं डॉक्टर साहब ध्यान से देखिए. ऐसे नहीं यार, कुछ चीजें तो आपको तुरंत पहचान जानी चाहिए फटाफट से. ये क्या है? Kyla-Dittis sign. Kyla-Dittis sign. Right? Remember, if the jejunum is enlarged, what will you see? You will see valvulae conniventis. If it is ileum, what will you see? Characterless loop of ileum. If it is large intestine, what will you see? You will see haustra and sacculations. So you can typically see haustra and sacculations here. Haustra and sacculation here. This is typically seen in cirrhosis. So when the colon lies below diaphragm, colon lies below diaphragm, and it is written in the book, it may be mistaken for a perforation. It may be mistaken for a perforation, जो कि आप में से 2-3 लोगों ने अभी गलती कर दी. Fine. Which of the nerves can be damaged in the following position? So your patient is lying in the lithotomy position. Your patient is lying in the lithotomy position. Both of the nerves can be damaged, because you see here, if you place some footrest, fine, if you place some footrest, then saphenous nerve can be damaged. If you don't place a footrest, then at this point obturator nerve can be damaged. So answer here, because there is no footrest, so answer here would be 2, that is obturator nerve. But doctor साहब कोई नहीं. Fine. Sustained pressure can damage. So in lithotomy position, saphenous nerve, obturator nerve and common peroneal nerve, everything can be damaged. बस फटाफट wind up करेंगे, don't worry. See here. So if you see a foot pedal, then saphenous nerve. At the knee joint, common peroneal nerve. Even lateral femoral cutaneous nerve can be damaged. See the different positions. सुपाइन पोजिशन हॉरिजॉन्टल, पेशेंट उल्टा लेटा हुआ प्रोन पोजिशन, ट्रेंडलबर्ग पोजिशन फुट एंड लो, रिवर्स ट्रेंडलबर्ग head and low, lithotomy position. So lithotomy position, there is flexion at the knee joint and hip joint. Fowler position, flexion at the hip, flexion at the hip. Fine. And then there is, limited flexion at the knee joint. Jackknife position, exactly opposite. Prone position, knee chest position. Now these are the position which they might ask you in the examination: jackknife position and knee chest position. Now this is the way to protect ulnar nerve. What is being done? Strapping of the limbs, strapping of the limbs, strapping of the limbs. Strapping of the limb. 26-year-old housewife has been brought to emergency. We'll check. Has been brought to emergency with complaint of sustaining burns, allegedly in a domestic accident. She was found to have 7% full thickness burns over her abdomen. The management should be, answer this. Please answer. So these are the cases where you should refer to the specialized burn center, because your patient has full thickness burns, so she requires referral to the specialized burn center. So these are the cases where you refer your patient to specialized burn center. After a major fire incident was reported at petrol pump. Why not 3? See, even they will do this. The problem is, third-degree burns don't heal without skin grafting. That can be done only in the dedicated burn center. So this, this thing is seen in Love and Bailey. Clearly given in Love and Bailey that these patients should be referred to a dedicated burn center. Fine. So even in the dedicated burn center, they will do this only. But first, we need to refer these patients. Hanji. After a major fire incident was reported, 26-year-old employee was brought to surgical emergency with complaint of sustaining burns. He was noticed to be in severe agony. That means there was pain. He was found to have thin-walled blisters. That means second-degree superficial burns. 20% partial thickness burn, partial thickness, second-degree superficial, second-degree deep. Chest, abdomen and back. Dr. Saab, intubation. So, some of you have answered intubation. Intubation is done if there is airway injury. Airway injury is suspected if there is history of being trapped, if there is facial, nasal, or palatal burns, if there is change in voice, if there is stridor, if there is soot in sputum. अब देखो डॉक्टर साहब, इसमें कुछ भी नहीं है ऐसा. The one which can suggest airway injury. Fine. And IV fluids are given in adults if they have more than 15% injury, if they have more than 15% burns. It is given in children if they have more than 10% burns. So I believe this is the correct approach. This is the correct approach. Fine. This is the correct approach. Yes, exactly. नजीब साहब जी, ट्रेक्योस्टोमी क्यों करोगे जब आपके पेशेंट को कोई एयरवे इंजरी ही नहीं है? Your patient will have airway injury only if these things are present. History of being trapped. पेट्रोल पंप तो खुली जगह है. फेशियल बर्न्स नहीं है, नेजियल बर्न्स नहीं है आपके पेशेंट को, पैलेटल बर्न्स नहीं है, देयर इज नो चेंज इन वॉइस, देयर इज नो स्ट्राइडर, खांसने पर कोई काली काली चीज नहीं गिर रही. Patient in the above question was examined again the next day. The burnt area is noticed to have. बताइए जी. हाँ, उसमें हो सकता है. So the next day, the burnt area always increases in size. Burnt area always increases in size. Visible burnt arteries and veins, they are seen in third degree burns. They are seen in third degree burns. Remember, our patient has second degree burns. 29-year-old shopkeeper sustained 2% partial thickness burns involving his non-dominant left hand. चाहे dominant हो चाहे non-dominant हो, काम तो करना है. Preferred management would be, yes, burn involving face, hand, joint, perineum should be referred to dedicated burn center. Should be referred to dedicated burn center. Should be referred to the dedicated burn center. Whether it is a dominant hand or a non-dominant hand does not make a difference. Does not make a difference. Burns involving face, hand, major joint or perineum should always be referred to the dedicated burn center. The following clinical investigation. First of all, tell me what is the clinical investigation being performed. So the doctor is trying to elicit Homan sign in case of deep vein thrombosis. Homan sign in case of deep vein thrombosis. Please tell me whether it is a good investigation, bad investigation or very bad investigation. सिंपल सी भाषा में बात करते हैं मेरी और आपकी. It's a very, very bad investigation. It has low sensitivity and low specificity. Homan sign. Homan sign. So there would be resistance to passive dorsiflexion of foot. Passive means done by the examiner. Low sensitivity, low specificity. होमन साइन के बारे में बोलते हैं that it may be positive in 50% of the patient without DVT also, may be present in those patients who have without DVT, who don't have DVT. 38-year-old shopkeeper, chronic smoker, probably Berger disease. Oh, he's suffering from Berger disease. Lumbar sympathectomy. Surgery went uneventful. See, buddy, this is not a question of surgery. This is a question of anatomy. So while you are doing sympathectomy, patient complains of groin pain, paresthesia, burning sensation. Which of the structure has been damaged? Which of the structure has been damaged? See, this nerve is commonly injured in hernia surgery. This nerve is commonly injured in hernia surgery. So it is the genitofemoral nerve. Genitofemoral nerve. Genitofemoral nerve. So genitofemoral nerve runs risk of damage during lumbar sympathectomy. During lumbar sympathectomy. Right? 32-year-old female presented to surgery OPD with 1-year history of soft, compressible swelling in the submandibular region. Swelling is soft, compressible, and squeezing the swelling causes a lump to appear in the floor of mouth. डॉक्टर साहब, ये देखो, ये क्वेश्चन मेरा नहीं है, ये क्वेश्चन किसका है जी? एनाटॉमी का. ये क्वेश्चन किसका है? ईएनटी का. फर्स्ट टेल मी, व्हाट इज योर पेशेंट सफरिंग फ्रॉम? Squeezing the swelling causes lump to appear in the floor of mouth. Answer is mylohyoid. But what is the diagnosis? At least tell me the surgery question. The surgery question is just the diagnosis. सर्जरी का क्वेश्चन सिर्फ इतना है कि डायग्नोसिस क्या है. You press the neck, swelling appears in mouth. You press the mouth, swelling appears in neck. Like this. What is the diagnosis? अरे यार, नाराज हो गए क्या? बस खत्म कर रहे हैं अभी. So it is a plunging ranula. It is a plunging ranula. Plunging ranula. Plunging ranula, which is an extravasation cyst. Which is an extravasation cyst. Plunging ranula. नहीं पढ़ा तो plunging ranula के बारे में एक बार दोबारा जरूर पढ़ेंगे. You all have to read about plunging ranula. It's an important topic in surgery, important topic in ENT, important topic in anatomy, right? Before being used for the patient, fresh frozen plasma should be thawed. The word thawed means melted in a water bath with a temperature between 30 to 37 degrees centigrade. Temperature higher than, remember, how do we store the plasma? We store it at minus 42 degrees centigrade. We store it at minus 42 degrees centigrade. Then it can be stored for 2 years. Don't ever place the plasma over the chest of patient for melting. No. Yes, please, what is the answer? Level of the clotting factor, especially the clotting factor 5, clotting factor 8. Remember, they are heat labile. They are heat labile. They are heat labile. What is the purpose? Why are we giving fresh frozen plasma? Because of multiple clotting factor deficiency. And if you heat it beyond 37 degrees centigrade, all the clotting factors would be destroyed. Fine. यार मैं तो कराता हूं ये वाला. 35-year-old woman at a purported attempt of femicide. Femicide is a hate crime when someone is killing the female just because of her gender. That I hate females, I'm going to kill the females. Fine. Purported attempt of femicide was punched repeatedly in the right side of abdomen and chest. Some right upper abdomen tenderness was noticed. However, there was no guarding or rebound tenderness. Result, see, this is a one liner. This is a one liner. This is a one liner question. Coiled spring, stack of coins. Yes. What it is? Coiled spring appearance. It is characteristically seen in duodenal hematoma. It is characteristically seen in duodenal hematoma. If there would have been rupture of duodenum, what would you have seen? You would have seen air under diaphragm. Contusion of the head of pancreas. You would have seen widening of C loop. Retroperitoneal hematoma. Retroperitoneal hematoma would have been visible on CT scan only. Fine. So your patient has duodenal hematoma. Typical one-liner. 50-year-old unrestrained driver is brought to emergency following a car crash. Fractured rib on the left side. CT scan shows left-sided retroperitoneal hematoma adjacent to left kidney. No evidence of urine extravasation. Yes, please tell. So remember, retroperitoneal trauma, zone 1 is central. What do you see? Major vessels are injured. Pancreas is injured. Duodenum is injured. Surgery always. Zone 2. Zone 2. Peripheral tissue. What is injured? Colon and kidney. Surgery only in case of penetrating trauma. Surgery only in case of penetrating trauma. Zone 3, pelvis. Surgery only in case of expanding hematoma. Expanding hematoma. So here you will just do the observation. Why? Because this is a zone 2 injury. This is a zone 2 injury. Right? Laparotomy not required because the patient is stable. CT guided aspiration not required. There is risk of infection. Surgical exploration not required because it is a blunt trauma. It is a blunt trauma. हाँ जी. 28-year-old रोड साइड एक्सीडेंट. ध्यान से देखिए इस फोटो को. You have given your patient barium. Roadside accident patient, you have given barium. I hope the resolution is good. Hanji, please. What is this? What you can see on your screen? 28-year-old man, roadside accident. So this is a classical case of diaphragm rupture with stomach herniation. See, it would be like this. So the diaphragm is there. Right? 45-year-old bus passenger was brought to surgery emergency after roadside accident. He is anxious, but otherwise fine. Later, he suddenly faints. He is promptly attended and is found to have warm extremities. Heart rate 46, blood pressure low. So if you see heart rate is low, blood pressure is also low. So what is your patient suffering from? डॉक्टर साहब ये तो सिंपल क्वेश्चन है, ये तो आंसर दे दो. इसका भी गलत आंसर दे रहे हो. So your patient typically has neurogenic shock. Cardiogenic shock. Remember, cardiogenic shock, blood pressure would be low, heart rate would be high. Hemorrhagic shock also, blood pressure would be low, heart rate would be high. You know, heart rate could be variable. Hypovolemic shock, practically the same. ये रहने दो, difficult question है. We'll do this tomorrow because that mood में नहीं लग रहे आप. Just give me the diagnosis if you can see it on good resolution. If you can see it on good resolution, just give me the diagnosis. Just give me the diagnosis. So your patient is suffering from pneumothorax. Your patient is suffering from pneumothorax, right? Pneumothorax. Okay, here. Give me the diagnosis here. In this case, give me the diagnosis. Remember, the meniscus is not seen. So your patient, see, this is the collapsed lung. This is the collapsed lung. So hydropneumothorax. See here, hydropneumothorax. So this is the collapsed lung. This is the level. Fine. So if you just have hydrothorax, you will see meniscus like this. You will see meniscus sign. So meniscus sign is seen if your patient just has hydrothorax. You'll get to see meniscus. Important. Fine. If it is hydropneumothorax, you'll get to see a straight line. If it is just hydrothorax, hemothorax, anything, there will be a meniscus. See, this is just hemothorax. Fine. And you get to see a meniscus. 42-year-old butcher suffers a traumatic amputation of 3 of his fingers while being inebriated. Inebriated means drunk. Medical history was found to be unremarkable. Which of the following modalities should be used to transport the amputated fingers with the patient? हाँ जी डॉक्टर साहब, ड्राई आइस never used, it will cause cryotrauma, cold trauma. Place in clean plastic bag filled with tap water. Tap water temperature is 15 to 17 degrees centigrade. Place the finger in clean plastic bag and then you put it in the box filled with crushed ice and water. This is preferred approach. Wrap the amputated. Never place it in dry gauze. Never place it in dry gauze. This will cause, if you place it in dry gauze, this will cause desiccation of the tissue. Desiccation means dryness. If you place it in warm water, that will increase oxygen demand of the tissue. So that means tissue पहले ही मरने लगेगा. Tissue will begin to die early. So C here happens to be the correct answer. Clinical feature of the following condition, because you may not have good visibility there. This is the urinary bladder. This is vagina. Right? Now, what is this? This is the ureter. So basically, your patient is suffering from ectopic ureter. Ectopic ureter in a female. What is the clinical feature? The most common clinical feature is continuous dribbling. Ectopic ureter in males, no dribbling, but your patient will have prepubertal epididymoorchitis, important. Make the diagnosis and then tell me the earliest clinical feature. See here, what you see on your screen is called thimble bladder. This is an intravenous urography image. Thimble bladder. So in the thimble bladder, what you see, there is decreased capacity. There is decreased capacity of the bladder, decreased capacity. So earliest clinical feature is increased frequency of micturition, increased frequency of micturition. Now, see, this is also thimble bladder. What is this? This is called golf hole ureter. Golf hole ureter. Non-contrast CT scan image. The clinical feature of your patient was colicky pain. It could be, Dr. Vidyaji, this will get from the history, whether it is hydropneumothorax or hemopneumothorax. This will get from history. If there is history of trauma, it would be hemothorax. Yes, please tell me, what is your diagnosis here? I'll zoom it up for you. ना डॉक्टर साहब जी, ये किडनी, ये कुछ रेडियो ओपेक सा, डेंस रेडियो ओपेक. See, investigation of choice for pancreatitis is contrast CT. Here you have non-contrast CT. Remember, non-contrast CT is the investigation of choice for ureteric calculi, is the investigation of choice for renal calculi. So here your patient has ureteric calculi, ureteric calculi. Why? Because your patient has colicky pain. Your patient has colicky pain. Very simple question. Very simple question. भाई इससे simple question ना हो सकता. Intravenous urography image. What is the diagnosis? Intravenous urography image. What is the diagnosis? Okay, I'll give you a hint. This red colored line which I have drawn is the midline. क्या डॉक्टर साहब? Horse shoe kidney. Horseshoe kidney. Horseshoe kidney. Kidney would have been far from the midline, but here you see they are so close to the midline. So that is typically horseshoe kidney. Typically horseshoe kidney. Yes, what do you get to see? The urinary crystals. You get to see some urinary crystals. Tell me age of the patient. Urinary crystals, how do they look like? So buddies, they look like coffin lid crystals. So coffin lid, triple phosphate, enveloped crystals, calcium oxalate. So triple phosphate is common in young, sexually active females because there will be increased chances of UTI, increased chances of urinary tract infection. Cysteine crystals are benzene ring crystals. Now, what is this crystal? What is this crystal? Calcium oxalate. Monohydrate. Remember mono. Mono means single. So single guy will go to the gym and will pick up dumbbells. Will pick up dumbbells. अब ये पता नहीं कहां से कॉपी किया है, जिन्होंने भी लिखा है बहुत ही सुंदर, बहुत ही बढ़िया लिखा है. सो यू नो माय स्पेशल थैंक्स. जहां से भी मैंने कॉपी किया मुझे याद नहीं पर कहां से कॉपी किया था. फाइन, पर बहुत ही बढ़िया, बड़ा सुंदर लिखा है अबाउट ऑल द calculus, about all the calculi and their crystals. See, cysteine crystals, cis, S stands for 6. Cysteine crystals, they have 6 sides. They have 6 sides. Triple phosphate crystals. Calcium oxalate crystals are enveloped by pyramidal. So they might ask you this: calcium carbonate crystals. They might ask you this: bilirubin crystals. Bilirubin crystals. Last question for the day. What is your patient suffering from based on the mammography finding? Plasma cell mastitis, typical finding which is seen in plasma cell mastitis. Plasma cell mastitis. Right? So we meet again tomorrow at the same time at around 7 o'clock. We'll meet again. And please tell me, what do you want? Like, you want more question, you want more discussion? We can always change the pattern according to you. Here you see the spicules. Yes, exactly. Here you see some of the spicules. The resolution is very poor. You see the spicules. So it is basically spiculated calcification suggestive of cancer, what you see on your screens right now. See, tomorrow we are going to discuss GIT and hepatobiliary only. We did not see GIT and hepatobiliary today. That I have reserved for tomorrow. Tomorrow we'll see GIT and hepatobiliary questions. Right? So we'll see each other tomorrow at around the same time, and tomorrow I promise I'll be on time. Right? Thank you. हाँ जी. PDF I'll send tomorrow. मुझे लगा आप एंड करें फटाफट मैं बात कर लूं.